Now, the government now says it will not be releasing the number of parliamentarians who have contracted the virus due to fear of stigmatization, a matter that raises concern over whether fear of stigmatization only rises when the statistics involve the high and mighty in the society vis-a-vis the common citizens. Zainab Mohammed with the details.
Every day at 3 p.m. in the evening,
11 more persons have tested positive for the disease today.
The daily COVID-19 briefs are addressed by officials from the Ministry of Health. Statistics that contain details of the common mwananchi, where they live, who they might have interacted with, where they have been quarantined, and the total number of people who have contracted the virus in the last 24 hours.
Today we have 120 people who have tested positive for COVID-19.
This daily briefs being termed as providing key information to Kenyans on the state of the virus in the country as a way of containing the spread of the virus.
We would like to appeal to all Kenyans to embrace the containment measures because these are crucial in terms of curtailing community spread and suppressing the pandemic.
However, the case is different when the virus touches the high and mighty in the society. When the virus first landed in State House, a statement was issued about it. To date, even the Ministry of Health officials say they do not know the exact number of people from State House who have contracted the virus, a matter that raised concerns from all over as many question the effects of the virus in the highest office in Kenya and the safety of the head of state and his family.
I actually do not have that information.
Another report emerged, this time COVID-19 in Parliament, with several members of Parliament being reported to have contracted the virus. When the Ministry of Health was asked about the numbers, the stand was rather shocking. The ministry saying it cannot release the number of parliamentarians who have tested positive due to fear of stigmatization. The Director General of Public Health even saying that informing Kenyans of the number of parliamentarians who have contracted the virus won't help them in protecting themselves against the virus.
I do not know why it is important to know how many parliamentarians have tested positive. Because in the way of fighting stigma, it is not important that we know how many bishops have turned positive, how many judges have turned positive. We have urged again and again individual responsibility. The numbers of parliamentarians who have turned positive is not going to help you not turn positive.
Not forgetting that the same leaders are treated with kids' gloves when they blatantly flout COVID-19 containment measures at will. Political rallies have become the norm rather than the exception, despite the Ministry of Health outlawing political gathering.
It will be difficult to know. Even some of you might have COVID here. You don't know where you have got it. You don't know where you have got it, actually. You can't say that a meeting in Kakamega, you got it there because you are in the meeting. You can get it anywhere.
The double standards by the government continues to raise questions, with COVID-19 being seen as a disease of the poor and only the poor should catch it and their details released to the public. When the politicians do, it serves no purpose to know them and how many they are. For TV 47, I'm Zainab Mohammed.